Welcome to the deep dive. We sort through the noise to find the signal, bringing you the essential insights you need. Today, we're tackling something pretty common, actually, that really frustrating mix of oily scalp, dandruff that just won't quit, and, well, the hair loss that often tags along, especially for adult men.
Yeah, and our mission here isn't just, listing symptoms or giving you quick fixes. We want to dig into the why behind it all. We're aiming for a holistic, evidence-based roadmap so you can really understand and manage your scalp's whole ecosystem for the long haul.
Okay, let's unpack this then. Why do these things, the oiliness, the flakes, the thinning hair, why do they seem to show up together so often? What's actually going on, under the skin?
That's a great question because they really are deeply connected. Often at the heart of this trio is something called seborrheic dermatitis, SD for short.
What?
Think of it as this chronic inflammatory condition. It loves oil-rich areas, so the scalp is prime territory. And the signs are pretty classic. Greasy patches, maybe yellowish or white scales, that persistent flaking we call dandruff, redness, and often a really intense itch.
That sounds miserable.
It can be, but here's something really important. SD isn't contagious. And the hair loss that comes with it, usually temporary, it's reversible if you get that inflammation under control.
Okay, so it's more than just having like an oily scalp day.
Exactly. The underlying issue is often what we call hyperseborrhea, fancy term, but it just means your sebaceous glands are working overtime, pumping out too much sebum or oil.
Right.
Now, a normal amount of sebum is good. It protects, lubricates, but too much, that's where the trouble starts. It clogs up hair follicles, kind of blocks oxygen and nutrients getting to the root, and it basically attracts dirt and all that excess oil. It's like rolling out the red carpet for Malassezia yeast.
Okay, I've heard of that. Is that yeast bad?
Well, no, not inherently. It's actually a totally normal part of everyone's scalp microflora. It loves oil. The problem is when there's so much oil, it provides this all-you-can-eat buffet.
Gotcha.
And the yeast population just explodes. It goes into overdrive.
So if I'm following this, it's not just the oil itself, but maybe what the yeast does with the oil that causes the real issues.
Precisely. You nailed it. As Malassezia feasts on all that sebum, it metabolizes the triglycerides in it. And what it leaves behind are these irritating free fatty acids like oleic acid.
Like waste products.
Exactly. Think of it like that. For people who are sensitive, and not everyone is, these fatty acids are the main trigger. They set off a big inflammatory response from your immune system.
And that's the cascade you mentioned.
That's the damaging cascade. Your immune system reacts to the yeast overgrowth and those irritating acids. That causes the redness, the swelling, that maddening itch, and it speeds up skin cell turnover.
Which is the flakes we see.
That's the flakes. Your skin cells are shedding way too fast.
Okay, wow. So beyond the flakes and the itch, how does all this actually impact the hair itself, like the growth?
Right. Well, Malassezia isn't just stirring up inflammation. It's also a source of oxidative damage. Cellular stress. This stress basically tells the hair follicle cells to die off too early. Programmed cell death. So it impacts the hair before it even emerges, leading to premature loss.
And then you add the scratching.
Exactly. The physical trauma. That intense itch makes you scratch, and that directly damages the follicles and the hair shafts. It weakens how the hair is anchored, causes breakage, makes everything look thinner.
So pulling it all together, this whole environment, the inflammation, the stress, the clogged follicles, the scratching, it really messes with the hair's life cycle.
Profoundly. It damages and blocks the follicles, it shortens the anagen phase, that's the active growth phase, and pushes hair into the shedding phase too soon.
And the hair that does grow back.
Often it's thinner, shorter, duller, weaker. We call that miniaturization. Plus, the weakened anchoring means hair just falls out earlier than it should.
So this is really crucial then. If you're dealing with this kind of hair loss, just slapping on some growth serum isn't the first step.
Absolutely not. You have to break that cycle first. Control the oil, reduce the Malassezia, calm down that inflammation and oxidative stress. You've got to, fix the soil before you plant the seeds, make the scalp healthy again.
That makes total sense.
Yeah.
Okay, so we've unpacked the why. Let's roll up our sleeves and talk how. What are the practical daily things someone can start doing? Because that routine is your first line of defense, right?
Absolutely. Let's start with washing.
Yeah, how often? That's always the question.
There's no single magic number, really. The goal is just to stop oil and scale from building up too much. For a lot of people, maybe 2-3 times a week works well.
Okay.
But if you're having a bad flare-up, you might need to wash daily just to get things under control for a bit.
But don't overdo it with harsh stuff.
Exactly.
Yeah.
Be careful not to strip your scalp with really strong cleansers constantly because that can actually trigger rebound oil production. Your scalp tries to compensate.
Right. You mentioned getting the most out of shampoos, especially medicated ones.
Yes, the double shampoo technique. It sounds simple, but it's really effective.
How does that work?
First wash is like a pre-rinse for your scalp. It breaks down the surface, gunk, heavy oil, product buildup, dirt. Rinse that out.
Okay.
Then, the second shampoo application. This time the scalp is cleaner, so the shampoo lathers better, and more importantly, the active ingredients can actually reach the scalp surface properly.
Makes sense. Maximize contact.
Precisely. And here's the really vital bit people often miss. You need to leave that medicated lather on your scalp for 3 to 5 minutes. Give those actives time to actually work. Don't just wash and rinse immediately.
3 to 5 minutes. Got it.
Yeah.
And you mentioned rotating shampoos.
Yeah, that's a smart long-term strategy. Maybe alternate between different types of active ingredients. For instance, use an antifungal shampoo for a few washes, then switch to one with, say, salicylic acid.
Why do that?
It helps maximize effectiveness and can prevent the Malassezia from potentially developing resistance to one single ingredient over time. Keeps things working better.
Okay, smart. Now, conditioner. I think a lot of guys with oily scalps skip this,
Right.
thinking it'll just make it worse.
This is a super common mistake, yeah. But many medicated shampoos, while great for the scalp, can really dry out the hair shafts.
Leading to breakage.
Exactly. Makes hair brittle, prone to snapping. So conditioning is essential, but you have to be strategic about it.
How so? What kind should you look for?
You want something lightweight, definitely non-comedogenic, meaning it won't clog pores. And ideally, silicone-free, or at least free of heavy, non-soluble silicones.
So avoid the really thick, heavy stuff.
Yeah, avoid those heavy oils, thick butters, or those rich anti-frizz formulas that often have things like mineral oil, petrolatum, or heavy silicones like dimethicone. They just coat everything and weigh it down.
And how you apply it matters too.
Right. Critically important. Apply conditioner only to the mid-lengths and ends of your hair. Keep it completely away from the scalp and the roots.
Why is that?
Your scalp makes its own oil. The roots usually get enough natural conditioning. You don't need to add more right there. You just need it for the older, drier parts of the hair shaft.
Okay, that's a great tip. Mid-lengths and ends only.
Yeah.
So let's talk ingredients. Staring at a bottle label can feel like trying to read code. What should people look for, and what are the big red flags to avoid?
It can be confusing, absolutely. But there are some definite antagonists for oily or SD-prone scalps. First up, harsh sulfates. Things like sodium lauryl sulfate, sodium lauryl sulfate.
Why are they bad?
They can be too stripping, over-cleanse the scalp, irritate it, and potentially trigger that rebound oiliness we talked about. Look for gentler, sulfate-free options if you can.
Okay, what else?
Be wary of drying alcohols, like alcohol denat, isopropyl alcohol. These can really irritate a sensitive scalp.
But some alcohols are okay.
Yes. Don't confuse them with beneficial fatty alcohols like cetyl alcohol or stearyl alcohol. Those are actually moisturizing and good for the hair. It's the harsh, drying ones you want to avoid, especially high up on the ingredients list.
Got it. Silicones.
Heavy or non-soluble silicones. Dimethicone, dimethicone are common examples. They can build up on the hair and scalp over time, potentially clogging pores and trapping oil underneath. Lighter, water-soluble silicones might be okay for some, but heavy ones are often problematic.
Okay. Anything else on the avoid list?
Yeah, mineral oil and petrolatum, they're very occlusive. They form a barrier. Good for trapping moisture in some contexts, but on an oily scalp, they can just worsen the greasiness.
Right.
And finally, synthetic fragrances and dyes. These are really common irritants and potential allergens for many people. If your scalp is already inflamed, these can just make things worse. Fragrance-free is often a safer bet.
That's a great checklist. So beyond the basics of shampoo and conditioner, are there other things we can use? What about scalp serums or pre-wash treatments? Do they actually help?
They absolutely can be useful additions, yeah. Think of them as adjunctive care. Leave-in scalp serums are typically lightweight liquids or lotions you apply directly to the scalp between washes.
What kind of ingredients should be in those?
Look for things like salicylic acid. We know it exfoliates and gets into oily pores. Niacinamide is great for reducing inflammation and helping regulate oil. Caffeine can stimulate circulation. Tea tree oil offers antimicrobial benefits. Pyroxenolamine is another good antifungal.
So they provide ongoing treatment between washes.
Exactly. And then pre-wash treatments. These are really helpful if you have stubborn, thick scales.
How do they work?
You apply them before you shampoo. It could be a gentle oil or maybe a specialized gel with keratolytic agents like salicylic acid again. You leave it on for maybe 1 to 3 hours.
And that softens the scales.
Precisely. It softens and loosens them up, making them much easier to lift away when you do your shampoo routine. It prepares the scalp for a more effective cleanse. And what's really cool here is how these specific active ingredients directly target those biological issues we talked about earlier. They offer real targeted relief.
Right. And like you said, knowing whether you're dealing with just simple oiliness, greasy hair but no major itch or flakes, versus actual seborrheic dermatitis with the oil plus the itch, the redness, those yellowish flakes, that helps guide which product to reach for first.
Exactly. That distinction is key. So let's break down some of the main players you'll find over the counter. First, ketoconazole. You'll see it as 1% OTC or 2% by prescription.
What does that one do?
It's a potent antifungal, really good at targeting that Malassezia yeast. Plus, it has anti-inflammatory effects too. And interestingly, it's been shown to help reduce the hair loss associated with SD.
Oh, interesting.
Yeah, just a little clinical nuance. Some people notice a slight increase in measurable oiliness at first. Don't panic, it's often a sign it's working, clearing out those clogged follicles.
Okay, good to know. What's next?
Zinc pyrithione, or ZPT, usually 1% or 2%, very common in dandruff shampoos.
Right.
It's antifungal and antibacterial. It messes with the yeast's metabolism, helps regulate sebum, and reduces those irritating fatty acids. Generally very well tolerated.
Okay. Another common one is selenium sulfide.
Selenium sulfide, yeah, typically 1%. It's got a dual action. It's antifungal against Malassezia, but it's also cytostatic. It slows down that rapid skin cell turnover. Fewer cells being produced means less flaking. Just a heads up, it can sometimes discolor very light or gray hair.
Good tip. And you mentioned salicylic acid earlier for serums and pre-washes.
Yeah.
Is it in shampoos too?
Absolutely. Salicylic acid at 2% or 3% is a great keratolytic. Think of it as an exfoliator for your scalp. It dissolves the cement between skin cells, loosening those scales.
And it likes oil.
Exactly. It's lipophilic or oil-loving. So it penetrates oily follicles really well to clear out congestion. It's often best used in rotation with antifungals, though. It clears the path, so to speak, so the antifungal can get in better.
Smart. What about coal tar? That sounds old school.
It is, but it can be effective. Coal tar, usually 0.5% to 5%. Like selenium sulfide, it's cytostatic, slows cell growth, and also anti-inflammatory. The downsides: it has a pretty strong, distinct odor, it can stain clothes and lighter hair, and it makes your scalp more sensitive to sunlight.
Okay, so pros and cons there. Any natural options?
Tea tree oil is popular, is usually found at 1% to 5% in shampoos. It's naturally antiseptic, antifungal, and anti-inflammatory. Definitely use it with caution, though. Do a patch test first, as some people are allergic or find it irritating if it's not properly diluted.
Right. So we have all these treatments to control the symptoms, but what about the bigger picture? People often ask, can I cure my dandruff? Is a permanent fix possible?
That's such an important point, and it really gets to the heart of managing this. The idea of a permanent cure for dandruff, especially if it's true seborrheic dermatitis, well, it's mostly a misconception. Because SD is a chronic condition, it relapses and remits, kind of like asthma or eczema, that Malassezia yeast. It's always going to be there. It's normal flora. So if you stop treatment completely, the conditions that allow it to overgrow and cause inflammation will likely return eventually.
So we need to reframe the goal.
Exactly. Shift your mindset from cure to sustained remission or long-term control. The aim is to knock down the acute symptoms, keep the scalp calm and clear for as long as possible, and have a plan for managing flare-ups when they do happen. Adopting that management mindset is really key for long-term success and less frustration.
That makes a lot more sense. Okay, so assuming someone's followed the steps, used the right shampoos, got the inflammation down, their scalp is calmer. Now, can we talk about stimulating hair growth? Because applying stimulants to an angry, inflamed scalp seems like a bad idea.
You're absolutely right. It's often counterproductive, can cause more irritation. You need a healthy foundation first. Once the scalp is stable, then you can introduce growth stimulants.
Like minoxidil.
Minoxidil, yes. Rogaine is the brand name many know. Available OTC in 2% and 5% strengths. It's FDA approved.
How does it work?
It's a vasodilator, so it increases blood flow to the follicles. It also seems to help prolong the anagen or growth phase of the hair cycle. You typically need to use it consistently for about 4 to 6 months to see visible results, and you have to keep using it to maintain them.
And you mentioned a specific type being better for SD.
Yes, absolutely critical point here. Many of the liquid minoxidil formulations contain propylene glycol. This ingredient is a very common irritant and can really aggravate SD symptoms.
So what's the alternative?
The propylene glycol-free foam formulation is strongly recommended for anyone with SD or a sensitive scalp, much less likely to cause irritation.
Okay, that's a hugely important detail. What about more natural routes for hair growth? I keep hearing about rosemary oil.
Yes, rosemary oil. It's genuinely compelling, and the research is quite interesting.
How might it help?
It seems to work in a few ways. It can improve blood circulation in the scalp. It's also anti-inflammatory, antibacterial, and antifungal, all bonuses for an SD-prone scalp.
And the growth aspect.
Some studies suggest it might inhibit an enzyme called 5-alpha reductase, similar to the prescription drug finasteride, which reduces DHT, a hormone linked to hair loss. It might also increase VEGF, which is vascular endothelial growth factor, similar to how minoxidil works.
Wow. Is there good evidence?
There was a notable randomized trial back in 2015. It directly compared rosemary oil extract to 2% minoxidil for hair loss over 6 months.
And the results?
Remarkably, the study found that rosemary oil was just as effective as 2% minoxidil in increasing hair count. And significantly, the rosemary oil group reported much less scalp itching than the minoxidil group.
That's pretty amazing, especially the less itching part for sensitive scalps.
Exactly. It makes it a very attractive option, particularly if SD makes your scalp prone to irritation. Just remember, if you're using the essential oil, you absolutely must dilute it properly in a carrier oil like jojoba or argan oil before applying it to your scalp. Don't use it neat.
Good safety tip. Any other botanicals worth mentioning?
Saw palmetto is another one. It's primarily known as a botanical 5-alpha reductase inhibitor, so it helps reduce DHT. It also seems to help regulate sebum production.
So kind of dual action there.
Yes. It's generally considered less potent than prescription finasteride, but that dual action of tackling DHT and potentially sebum makes it relevant for this conversation. You can find it in oral supplements or some topical formulas.
And briefly, anything else showing promise?
Well, caffeine is often included in topical hair products. The idea is it stimulates circulation. Research is still emerging, but looks promising. Peptides are also getting attention. They're like signaling molecules, potentially helping with follicle health, but still somewhat experimental. And niacinamide, which we mentioned for serums, is also good here for boosting circulation and its anti-inflammatory effects.
Okay, so we've covered scalp care, treatments, but what about the bigger picture? How does our daily life, our diet, our stress levels tie into all this? It feels like the scalp is almost a window into our overall health sometimes.
That's a really insightful way to put it, and it's largely true. There's a strong concept emerging called the gut-skin-scalp connection.
Okay, tell me more.
The idea is that systemic inflammation throughout your body can absolutely manifest on your skin, including your scalp. And that inflammation can often start in the gut, maybe due to an imbalanced microbiome, or be fueled by a generally pro-inflammatory diet.
So what we eat can directly impact our scalp's oiliness or dandruff.
It certainly seems to play a role for many people. Certain dietary patterns can act as triggers or exacerbators. High glycemic foods are a big one.
Like sugar, white bread.
Exactly. Sugars, refined carbs, they cause spikes in insulin, and insulin can stimulate androgen activity, which in turn ramps up sebum production. More oil.
Okay, what else?
Dairy products are often implicated. The hypothesis is they might influence hormonal balance or sebaceous gland activity in susceptible individuals. It varies person to person. And generally, diets high in saturated fats and overly greasy foods can be pro-inflammatory and just harder for the body to process efficiently.
So it's partly about avoiding triggers, but also about making sure we're getting the right stuff. Right. The nutrients our hair and scalp need.
Precisely. Nutritional support is vital. Protein obviously is fundamental. Hair is mostly keratin, which is a protein. Aim for about 0.8 to 1 grams per kilogram of your body weight daily. Get it from varied sources, both animal and plant. Iron deficiency is a really common, often overlooked cause of diffuse hair shedding. Iron's crucial for carrying oxygen to the follicles.
Good one. Zinc. I hear that mentioned a lot.
Zinc is huge. It helps regulate sebum production. It's vital for hair tissue growth and repair. It's anti-inflammatory, even has some antifungal properties. Zinc deficiency is definitely linked to both hair loss, alopecia, and seborrheic dermatitis.
Wow, okay. Vitamin D?
Vitamin D is another key player. Low levels are associated with increased risk and severity of SD. Plus, it seems to be involved in creating new hair follicles, though that's more complex.
Mm,
Many people are deficient, especially in certain climates.
right. What about B vitamins? Biotin.
B vitamins generally are important for metabolism. Pyridoxine, or B6, helps with zinc absorption and sebum regulation. Biotin, B7, gets a lot of hype for hair. It is essential, but supplementing only really helps if you're genuinely deficient, which is actually quite rare. Taking massive doses if you're not deficient won't magically boost hair growth.
Good clarification. Omega-3s.
Omega-3 fatty acids, super important. Found in fatty fish like salmon, flax seeds, walnuts. They are potent anti-inflammatories and vital for maintaining a healthy skin barrier function.
And antioxidants.
Definitely load up on antioxidant-rich foods, fruits, vegetables. They help protect your hair follicles from that oxidative stress we discussed earlier.
Okay, but a word of caution. Can you overdo supplements?
Absolutely, this is critical. Over-supplementing certain nutrients can paradoxically cause hair loss. The main culprits here are vitamin A, vitamin E, and selenium. More is definitely not always better. Stick to recommended daily allowances unless advised otherwise by a doctor based on blood work.
So diet helps manage things, but it won't cure male pattern baldness on its own.
Exactly. Diet is a powerful modulator. It can significantly influence scalp health and inflammation, but it's not going to reverse genetically driven hair loss by itself. It's part of the puzzle.
Makes sense. Okay, beyond diet, stress. It feels like stress messes with everything. Does it impact the scalp too?
Oh, absolutely.
Yeah.
Massively. This brings us to the cortisol connection.
Cortisol, the stress hormone.
That's the one. When you're chronically stressed, your cortisol levels stay elevated, and high cortisol can directly stimulate your sebaceous glands to produce more oil, leading to greasiness and potentially triggering SD flares.
Wow. And can it cause hair loss directly?
It can contribute. High stress can push more of your hair follicles into the resting or telogen phase prematurely. You might not see the shedding immediately, but maybe a few months later, a condition called telogen effluvium.
So managing stress isn't just good for your mind, it's good for your scalp and hair.
Definitely. Finding effective stress management techniques is crucial. Things like regular physical activity, mindfulness, or meditation practices, even simple deep breathing exercises. And don't underestimate sleep. Getting adequate, high-quality sleep, usually 7 to 9 hours for most adults, is essential for hormone regulation, including cortisol.
What about exercise specifically? Any benefits there?
Yes, exercise is fantastic. It improves blood circulation everywhere, including the scalp, delivering more oxygen and nutrients to the follicles. Plus, it's a brilliant stress reducer, lowers cortisol, releases endorphins.
Any caveats? Can you exercise too much?
Interestingly, yes, there's a potential downside to chronic, excessive, high-intensity exercise. Saying research suggests it might, in some individuals, actually increase cortisol or even DHT levels over the long term. So like most things, balance is key. Listen to your body, incorporate rest days. And all this discussion, it naturally leads to the question, when do you need to stop self-treating and actually see a professional? When is it time to call in the cavalry?
Right. When is it beyond DIY?
There are some pretty clear red flags. Definitely seek a dermatologist's opinion if you've been consistently using appropriate over-the-counter treatments for, say, 4 to 8 weeks, and you're seeing little to no improvement.
Okay. What else?
If your symptoms are severe or really distressing, we're talking intense, unbearable itching, very prominent redness, really thick, stubborn scales, or even pain. Any signs of a possible secondary bacterial infection like oozing, yellow crusting, unusual tenderness that needs medical attention promptly.
And if hair loss is noticeable?
Yes, if you're seeing clear hair thinning or loss happening alongside the oily scalp and dandruff, it's definitely time for a professional evaluation to understand the exact cause and relationship.
And sometimes you just don't know what it is, right?
Exactly. Diagnostic uncertainty. If you're not totally sure it is seborrheic dermatitis, maybe it could be psoriasis or a contact allergy or even a fungal infection like tinea capitis, a dermatologist can perform the necessary tests to get an accurate diagnosis. That's crucial for effective treatment.
And specifically, should people see a dermatologist or maybe a trichologist?
Good question. For a diagnosed medical condition like seborrheic dermatitis, which involves inflammation and often needs prescription treatments, a board-certified dermatologist is the most appropriate medical professional. Trichologists often focus more on the cosmetic aspects of hair and scalp health, but aren't typically medical doctors.
Okay, dermatologist it is. So once you're there, what kind of prescription options might they offer if OTC isn't cutting it?
For getting acute flares under control quickly, dermatologists often prescribe topical corticosteroids. These are powerful anti-inflammatories. They work fast to reduce redness, swelling, itching.
But they have downsides.
Yes, they're generally meant for short-term use only, maybe 1 or 2 weeks. Long-term use can lead to side effects like skin thinning, stretch marks, even rebound flares when you stop, so use them exactly as directed.
Are there non-steroid options?
Yes, there are topical calcineurin inhibitors, or TCIs. Examples are pimecrolimus and tacrolimus creams. They also reduce inflammation but work differently from steroids, so they don't carry that risk of skin thinning.
Any drawbacks to those?
They can sometimes cause a burning or stinging sensation when first applied, though that often subsides. They're a good option for maintenance or sensitive areas.
What if topicals just aren't enough for really severe cases?
For very severe, widespread, or stubborn SD that doesn't respond well to topicals, a dermatologist might consider systemic treatment. That means medication taken orally.
Like what?
Oral antifungals, such as itraconazole or fluconazole, these reduce the Malassezia yeast levels throughout the body. They're usually prescribed for a limited course, maybe a few weeks to get things under control. Then you'd likely transition back to topical treatments for maintenance.
Is oral ketoconazole used?
Very rarely nowadays for SD due to a higher risk of liver problems compared to other oral antifungals.
Okay. Any other systemic options for extreme cases?
In the most severe treatment-resistant situations, a drug called isotretinoin might be considered. It's very effective at shrinking sebaceous glands and reducing oil production, but it comes with significant potential side effects and requires careful monitoring, so it's reserved for extreme cases.
Got it. So moving beyond pills and creams, are there any in-office procedures or devices that can help with this whole picture, the inflammation and the hair growth?
Yes, absolutely. Device-based modalities are becoming increasingly sophisticated and offer some exciting dual benefits. One popular option is low-level laser therapy, or LLLT.
And like those laser caps or headbands.
Exactly. They typically use red light around the 650-680 nanometer wavelength. The benefit is twofold. It stimulates the hair follicles, boosting cellular energy, ATP, and circulation, which helps prolong that growth phase.
And the inflammation part.
Crucially, LLLT also has a proven anti-inflammatory effect. It helps reduce pro-inflammatory cytokines in the scalp tissue, so it can calm the scalp while encouraging healthier growth. It's non-invasive, generally very safe, and home-use devices make it convenient.
That sounds promising. What else?
Another powerful treatment, particularly known for hair growth, but also beneficial for inflammation, is platelet-rich plasma therapy, or PRP.
That's the one using your own blood, right?
That's right. They draw a small amount of your blood, spin it down in a centrifuge to concentrate the platelets and growth factors, and then inject this concentrated plasma back into your scalp in the areas needing treatment.
And the benefit.
It's a potent hair growth stimulant because you're delivering a high concentration of your body's own healing and growth factors directly to the follicles. But significantly for SD sufferers, PRP also has strong anti-inflammatory properties. It can help alleviate that chronic inflammation, repair some of the damage caused by SD, and create a much healthier scalp environment overall.
Okay, PRP. So for our listeners, maybe specifically those in a place like Mumbai, trying to navigate this.
Yeah.
How would they find reputable clinics, and what kind of costs are we talking about roughly?
Right, real-world application. In a major city like Mumbai, you've got options ranging from large, well-known hospitals like Nanavati Max Super Specialty Hospital to specialized hair and skin clinic chains, names like Richfield or Berkowitz come to mind, and also highly respected individual dermatologists or trichology clinics, maybe Dr. Rinki Kapoor, Dr. Manisha Saini's Revive Clinic, Revital Trichology, among others.
How do you vet them?
Online platforms are your friend here. Practo, Just Dial, even Google reviews. Look for board certifications, years of experience specifically in hair loss and scalp conditions, and read patient testimonials carefully.
And the cost factor. It can vary wildly, I imagine.
It really can. These are just rough estimates for Mumbai in Indian rupees. An initial dermatologist consultation might be anywhere from 500 to maybe 2,000.
Right?
PRP therapy that usually requires multiple sessions could range from 5,000 to 15,000 per session. Mesotherapy, another injection technique sometimes used, might be 1,500 to 4,000 per session.
If it comes to hair transplantation.
For hair transplants, the older FUT or strip method might range from 30 to 100 per graft. The more common FUE method, where follicles are extracted individually, is typically more expensive, maybe 50 up to 150 or even more per graft, depending on the clinic's reputation and technology.
So a typical procedure.
Yeah, so for example, a transplant of around 1,500 grafts could cost anywhere from roughly $45,000 on the low end for FUT, up to perhaps $1,035,000 or more for high-end FUE. A larger FUE procedure, say 3,000 grafts, could easily exceed Euro 2,000 or 3 Lardos. These are just ballpark figures. Always get specific quotes.
Okay, wow. That's a lot of information. Let's try to pull it all together now into a practical, actionable plan. How can someone build their own personalized strategy to get that long-term control we've been talking about?
Right, let's structure it. We generally think in terms of a stepped care approach. You start aggressively, then stabilize, then maintain. It adapts based on how your scalp responds.
Okay, so phase 1, getting things under control.
Exactly. Phase 1, gaining control. This is typically the first, say, 1 to 8 weeks. The main goal here is to hit hard and fast. Reduce that inflammation, scaling, itching, and excessive oiliness as much as possible.
What are the key actions?
You implement those foundational cleansing and conditioning techniques we discussed, double shampooing, applying conditioner correctly to ends only, and you start rotating appropriate OTC medicated shampoos. A common approach is ketoconazole 1% or 2%, used maybe 2 or 3 times a week,
Okay.
alternating with a salicylic acid 2-3% shampoo on the other wash days to help exfoliate and clear buildup.
What if it's a really bad flare?
If it's severe, this is when a dermatologist might prescribe a short course of topical corticosteroids just to quickly calm things down. And crucially, phase 1 is also when you immediately start implementing those dietary changes and stress management techniques. Don't wait on those.
Right. Tackle it from all angles. So once the fire's put out, so to speak, what's phase 2?
Phase 2, stabilization and hair growth focus. This might be from around month 3 to month 6. The scalp is calmer now. The goal shifts to maintaining that calmer state and beginning to introduce targeted treatments specifically for hair growth now that the environment is healthier.
How does the washing routine change?
You'll likely transition to a maintenance cleansing schedule. Maybe use your medicated shampoo just once or twice a week to keep things in check, and use a gentle, sulfate-free shampoo on the other wash days.
And this is when the growth stimulants come in.
Yes, this is the ideal time to introduce your chosen Tier 2 growth stimulant. That could be applying rosemary oil daily or using that propylene glycol-free minoxidil foam twice daily. Consistency is key here.
What are LLLT?
If you've decided to go with low-level laser therapy, phase 2 is a great time to integrate it into your routine, typically using the device 2 or 3 times per week as directed.
Okay, so things are stable, growth is being encouraged. What's the long game? Phase 3.
Phase 3, long-term maintenance and flare-up prevention. This is basically from month 6 onwards. The goal now is sustainability, keeping your scalp healthy, preventing major relapses, and continuing to support hair health.
What does that look like day to day?
You'll likely continue with your chosen growth stimulant, minoxidil, rosemary oil, etc., as long as you want to see the benefits. Keep up with your maintenance medicated shampoo schedule, maybe once a week or once every 2 weeks, depending on your needs. Continue LLLT if you're using it.
And managing flare-ups.
This is crucial. Start identifying and tracking your personal triggers. Is it stress, a certain food, change of seasons? Knowing your triggers helps you anticipate and potentially avoid flares. And have a flare-up kit, if you will.
What's in the kit?
It might mean temporarily increasing the frequency of your medicated shampoo for a week or 2. Or, if you have one prescribed by your dermatologist, using a topical corticosteroid for a few days just to nip a flare in the bud before it gets bad.
Okay, that makes sense. Be prepared. So wrapping this all up, what's the ultimate prognosis here? For someone struggling with this triad of oil, flakes, and hair loss, is there really light at the end of the tunnel?
There absolutely is. The most important message is this. Yes, seborrheic dermatitis is typically a chronic condition, but effective long-term management and achieving extended periods where your scalp feels completely normal, that is absolutely achievable for most people.
And the hair loss associated with it.
That's the other key takeaway. In the vast majority of cases where hair loss is directly linked to the inflammation and microbial issues of SD, that hair loss is temporary and reversible. Once you control the underlying scalp condition, the hair usually grows back.
But it takes time.
It takes time and consistency. Be patient. Seeing significant, cosmetically pleasing regrowth isn't instant. It typically takes 6 to 12 months of consistently sticking to your management plan. It truly is a journey, not a sprint. Hashtag tech tag outro.
So the big message seems to be that getting to a healthy scalp and encouraging robust hair growth, well, it's not about hunting for one single magic bullet. It's really about embracing a personalized, multi-step strategy that addresses everything from cleansing to diet to stress. We really hope this deep dive has given you a clearer picture and some actionable steps. And of course, we always encourage you to take this information and discuss it with a board-certified dermatologist to get guidance that's perfectly tailored to your unique situation. And here's a final thought to leave you with. If you think of your scalp like a garden, you wouldn't just throw fertilizer on weeds and compacted soil, would you? You'd prepare the ground first. You'd weed, you'd aerate, you'd improve the soil health. Understanding this holistic approach, preparing the scalp before focusing solely on growth, really empowers you to cultivate the kind of long-term hair health you deserve.